This segment of DelmarvaLife is sponsored by TidalHealth.
There are a few things that make a business thrive. First and foremost is making the customers happy. Of course, there are infinite components to creating a successful company, everything from the schedules, the employee, the overhead costs. But at the end of the day, providing quality service is arguably the most important factor.
And once that becomes part of a business's reputation, they endure for decades, always striving to improve. And sometimes that reputation continues for decades, and in this case, 40 years. That's certainly the case with TidalHealth Home Care, and this is Beverly White, the Vice President of Business Operations. She's joined today by Gina Hammond, a registered nurse case manager. Welcome to DelmarvaLife.
Good to see you, ladies.
Thank you.
So Bev, tell us about, or share with us, the legacy of TidalHealth Home Care over the past 40 years.
So our legacy is rich with community. So initially in 1985, what was then Peninsula Regional Medical Center started a home care agency just to meet the needs of the local community that were discharging from the hospital. And what has grown over the last 40 years has become truly a labor of love that has reached so many areas of the Eastern Shore, now on all 3 lower counties of the Eastern Shore of Maryland, and now for the last 20 years reaching into the Eastern Shore of Delaware into Sussex County.
So you have been part of TidalHealth even before you became TidalHealth Home Care.
Yes, so Peninsula Home Care was the original agency, and then in the latter part of 2024 in October, to align with the TidalHealth system, we made the choice to go ahead and rebrand so that we could align, so that our patients would know that choosing the health system as a whole would help them to know that they were choosing one place to receive all of their services, and then they would have shared services and a shared team for shared knowledge, that they would be able to come and choose a home care agency when they were leaving the hospital, so that there was a team that could talk with each other, share information, share also their health history, so that way there was continuity of care when they were leaving the hospital.
So Gina, you've been part of the team for 20 years. What is the part of your job that you just love so much?
The most rewarding aspect of working with the company is the personal relationships with the patients and their families. To be a sense of calm in their chaos, and knowledge with their medical knowledge deficits, and a place of comfort, you know.
And what keeps you going each day? Because every day's got to be a challenge.
The relationships with the patients. They count on me, they trust me. I'm their advocate.
That's
their
important.
Gratitude.
Yeah. 40 years. Here's to another 40 years. What does TidalHealth Home Care look forward to in the future?
Yeah, you know, it is ironic. We were talking about that before we came to the show today, and home care has evolved so much, and even over Gina's time with us, and we have had to respond to the needs of the community. There are still so many gaps in what is out there for our patients, and we have such a diverse community out here of patients. And even though we have new providers coming to our area, and we have different people retiring and moving to our area, there are still so many services that aren't quite here yet. In our health system, TidalHealth is doing a wonderful job at building new services to come. They're getting different kind of specialists and doctors to come here, so that the wait list to get into programs are not as long. However, to bridge the gap, TidalHealth Home Care we are training our teams in advanced practice services like advanced practice wound care, lymphedema, vestibular balance, so that we can provide those resources in the home. Because sometimes the wait list to get into those programming, those services are still sometimes 4 to 6 to 8 weeks long. We still have patients that are so limited at home that they may not have transportation to get there. So to be able to even get there, you have to start somewhere so that it doesn't get worse before you can get better. So we are always, and our clinicians they're the ones that are seeing it. Because when they go to the hospital, they don't always know what the patient's needs are like that. Our clinicians see it in real time, what those gaps are, and they're coming back to our office, our agency, and sharing those gaps, and our social worker, and saying, here's what they need and what we don't have, so that we can continue to educate our staff and keep their skills acute and sharp and advancing, and what's next for them, so that our patients in the community can get what they need.
Thank you so much, Gina Hammond and Beverly White with TidalHealth Home Care. Thank you so much for coming in.
Thank you for having us.